So just wanted to get us started and introduce this segment of our meeting, our beloved Pacha to the People session. And this is where Pacha has been encountering and engaging communities directly for the past couple of years. And typically, Pacha meetings are held sometimes, oftentimes, in the Washington, D.C. area. And so since Pacha to the People, there's been an intention of moving these meetings geographically around the country to places and locations that are highly impacted in order to hear more directly from community. Since we are virtual today, and usually during our virtual meetings, we create the same opportunity using our virtual space. And so here we are this afternoon. We do have about 40 or so minutes for this conversation. It is open to anyone in the community to talk. We are here to listen, and just wanted to also encourage Pacha members, if you feel so inclined to respond or to chime in, you are free to do so during this conversation. It truly is our less formal, informal way of communicating directly with community. So it drives the heart of our work. And so we are absolutely poised to listen and to hear, but also to engage. If you would like, please feel free to put your cameras on, raise your virtual hands, and Vincent and I will do our best to co-facilitate wherever the conversation may lead us. I see, Dr. Moore, you are geared up with a question or a comment, so I'll stop and let you chime in right now.
Thanks, Marlene. Good afternoon, everyone. So I did want to share that the Stigma and Disparities Committee is gearing up for our annual planning session that we have, and we'll be having that in February. And so we love to hear from community about priorities that should be considered as we do our planning. So just wanted to put that out there as well as you're making comments. If there are any priorities for stigma and disparities that you'd like to raise, please raise those as well. Thank you.
Thank you so much, Leo. So Nina, I think we see your hand raised.
Yes, I will keep my camera off just to save bandwidth, but my name is Nina Martinez. I was very glad to hear today several iterations of support for the 10-year-old law that is the HIV Organ Policy Equity Act of 2013. Thanks, Obama. It just turned 10 last month. Lots of folks in the HIV community are unaware of this law that permits organ transplantation between people living with HIV. I have the distinction of being the first living kidney donor with HIV in the United States, thanks to the HOPE Act. So the answer that everyone is searching for, that I will lay clear here, is that there is a current recommendation sitting gathering dust on Secretary Becerra's desk to take these transplants out of the research restricted protocols that they have been in for the last 10 years, because we have enough data to show that these transplants work and are ready to come out of research and become part of clinical care. However, Secretary Becerra needs to hear from the HIV community, and particularly also PACHA, that this is a priority in the HIV and aging discourse. So I think that is probably the most specific ask that could come out of today's meeting that is ready for action. And I would appreciate you all's support of myself, my 2 fellow living donors, and the 400 other HIV positive people that have served as deceased donors, making life happen for aging people with HIV who experience end-stage organ disease. Thank you.
So thank you very much, Nina, for that comment. It's an honor to have you with us today. And I just want to say that I think that we started to address the issue in some of the response that Kay Hayes provided. But I just will say, and Marlene, feel free to chime in, or other PACHA members, that we've got more work to do in this area. And it's certainly something that, as a committee, that we will revisit and get back to the folks that are here today.
Agree completely. And I appreciate Kay offering up the idea that we might host a bit of a primer for PACHA members to become aware. You're right on point, Nina, not just the general public not being aware, but communities of people living with HIV and those of us involved in HIV work need to become more aware. So appreciate your lifting that up for us today. Go ahead, Kay.
Sure, thank you. And absolutely, my team colleague Jim Berger leads what's called the Advisory Committee on Blood and Tissue, and they have weighed in on this. And then HRSA has its advisory committee, and those two entities work very closely together on this and lifting those recommendations. I know my team is as eager as I hear Nina speak. So absolutely, and we can follow up with my sort of subject matter experts to do a deeper dive briefing for colleagues here. And then as PACHA does what PACHA does, can follow up appropriately with guidance and follow up.
Anyone else want to chime in? I see some community names who are usually eager to share with PACHA. I'll call on you, but I'm certainly hoping that you are here to share something important with us. Go ahead, Jesse. And you're on mute.
Sorry. Quick question with regard to the HOPE Act and what we're talking about. Is it my understanding that we should also include sperm donation as a topic to be covered under this as well?
The law is specifically for solid organ transplants, but I know that other countries in the UK are actually exploring sperm donation, but I don't believe the FDA has quite caught up to that yet. They oversee all IVF cycles in the United States. I'll also say that I was a former public health analyst at the Centers for Disease Control and Prevention, as well as a living kidney donor, so I do know the HOPE Act intimately. Thank you.
Yeah, so great question, Jesse. I think there's just a lot more to be heard and learned so we can be clear as a body about ways in which we may individually or collectively as a group want to address some of the concerns raised by Nina now, but by others earlier in the meeting.
Maybe I'm thinking of a package of issues, both transplant issues. We've already started to address blood donations, but I think sperm donations is in the broader category that PACHA needs to look at.
Yep, I hear you. Anyone else? This is your time. I know we had a couple of members earlier who had hands raised and we did not have opportunity to take your comment or question at that time. It's certainly appropriate if you have an issue you'd like to raise here or a question you'd like to raise here. The floor is yours.
Yeah.
Okay, it sounds like you were trying to chime in, Mackenzie. Feel free to go ahead.
I was, and then I saw people following the rules and putting their hands up, and I thought, I can hold for half a second because I think mine's a little bit like evergreen and not like it doesn't need to be like immediately about another comment. Amir, do you want to go? I didn't mean to cut you off.
No, Mackenzie, I mean, honestly, I think something that I wanted to put on PACHA's radar might also be a bit evergreen. So Cordella, I don't know if there's something that was discussed specifically today during the full council meeting that you'd like to raise. I'm happy to also kind of hold off as well.
Oh, thank you. And I apologize. I wasn't able to join the earlier part of the meeting. But one of the concerns that I have is how are we working to engage pediatricians in ending the epidemic? I live in Southeast Texas, And so far this year, I have 3 people newly diagnosed living with HIV between ages 15 and 17. And I know that they have built trust with pediatricians, both the parent and the child. But if this conversation is not getting through at that early stage of healthcare, it is very difficult then for us to start having that conversation later on. So how are we going to engage those providers in the conversation to make sure we can at least prevent younger people from, being identified with HIV?
Excellent comment, Cordella. And I think one of the conversations that kept resounding earlier in the meeting today, and certainly on past meetings as well, and I think you consistently helped us to focus our lens on what more we can do around engagement with the clinical and medical workforce. And for us, I think hearing your concern and what we've seen and a lot of the recent data around HIV and STIs in young people and young adults centers this issue right in front of us. So I appreciate your continued lifting that up and charging us with addressing the needs here. And so I don't know if others want to respond directly to Cordella, but it certainly resonates with what's been coming up in our conversation today. So I appreciate that.
So Marlene, just really quickly, because I see there are a number of hands. I think a couple of people have evergreen comments they want to raise. But I do want to say directly to Cordella, there's some great work that's happening through the HIV Medical Association, which is a national group of providers, all different kinds of providers, physicians, advanced practice providers, nurse practitioners, physician assistants, pharmacists, et cetera, that are working on trying to really prepare a workforce, both a specialty workforce that can deal with a number of issues and, obviously youth, but all the things we've been talking about today, from trans experience, aging, et cetera, and then also ways of using a workforce that we know is limited and that is experiencing some challenges to really bridge between HIV specialist and a generalist sort of primary care and other kinds of providers. And I think that work is really intended to ensure that we have enough providers who both specialize and also that there is a sort of a workforce that's a generalist workforce that can sort of manage the things that don't require a specialist. And so I don't know if that's answering the question, but I want to say that I think that there is actually a lot of work going on, and it maybe would be important to kind of check out HIV-MA.
Thank you. I'm trying to get more into the prevention aspect and the testing for early detection, because the 3 people who have identified were identified in the emergency department through routine testing. Now, they may have been in going for a physical for back to school with a pediatrician, but they were identified in the emergency department through routine testing, where HIV was not the reason why they came in or any kind of suspicion of having an STI. So that's my concern with how do we get providers, family practice, pediatricians, and so on, to be more aware of the increased risk that our young people are facing and making sure those conversations are being had in the spaces and the opportunity to test.
Agree. And clearly those missed opportunities there along the way in their healthcare. So duly noted, Cordella. And I see a number of hands that have now come up in chat, so we will go in order. Jeffrey, Philip Chan, and then Mackenzie. Go ahead. Thank you.
So Dr. Kwong in his presentation earlier today, and then several other people later on, mentioned the attrition in the HIV workforce. We just don't have enough bodies to provide care due to aging out and the more experienced providers. COVID certainly took its toll. And then when it comes to providing appropriate geriatric informed care, we don't have enough geriatricians in the general population, let alone in HIV. So I think this is a really urgent, given the demographics and where they're going, it's a really urgent issue that perhaps we could take a lead on addressing with things like increasing the length of appointments for older folks with HIV. 15 minutes is not enough to deal with polypharmacy and multiple comorbidities. Training new people. Increasing the reimbursements that they get through Medicare and Ryan White and others with other payers. And then how do we train people? Do we put together loan forgiveness programs, that sort of thing, to really incentivize people to go into the field? Because otherwise we're going to be really behind the 8 ball in the very near future as people start aging and require much more intense clinical care. Thank you.
Dr. Chan, go ahead.
Yeah, so good evening, everyone. I'll be quick, just a quick, exciting update, I think. Have people heard about DoxyPep? Has anyone heard about DoxyPep? Most people are nodding their heads, but so this is on the verge of being recommended by the CDC. And before the next time we meet, it's probably going to be recommended by the CDC for gay, bisexual, other men who have sex with men, and transgender women. So if you don't know much about it, it's there's some good websites. I'll put a link to the major study that was published this past year in the New England Journal of Medicine. But it really has the potential to transform bacterial STI prevention, including in people who live with HIV. The major study that I'll put in the chat here was done in people living with HIV and people on PrEP, but very effective. And a lot of people are comparing it similar to HIV PrEP, DoxyPep for STI prevention. So just good news on the STI front, and I think especially for folks that are affected by bacterial STIs, including people living with HIV. Thank you.
Absolutely, Dr. Chan. Thank you for lifting up that resource as well in the chat for those who want more information. I do want to, since PACHA-to-the-People is for our primary goal of listening from community, I just want to invite our community members, because I know they have been in queue, to go ahead and speak, and then I'll take the rest of the PACHA members' hands in order. So I see Cassandra, and then I'll invite Amir to come back if he's willing to give his statement at this time, and then we'll go on to Carol and Duvia. Go ahead, Cassandra.
Good afternoon. So my name is Cassandra. I am a PharmD. I'm actually prescribing PrEP via collaborative practice agreement. So being that pharmacy, there's a pharmacy within 5 miles of everybody's home. You always have access to a pharmacy. So I definitely believe that there needs to be advocacy and, making it clear, because, piloting this, it's been really challenging to navigate the laws and what we can and cannot do. But we're taking on that challenge and working through it. But I think that, PACHA should, kind of bring that into the conversations and maybe create guidelines to help the different states, because studies do show that when pharmacists do prescribe it, patients get on it and they are adherent with it. So that was just like a comment that I wanted to make, and hashtag pharmacist provider status.
So really quickly, Cassandra, just a response to what you and also what Jeff raised around workforce. So one of the things that PACHA is doing is that we're currently working with CHAC on really thinking through how we can draft some sort of letter or resolution regarding workforce issues. And so that's work that's currently happening. And Wendy Armstrong, who I'm not sure is on the call today, and myself and a number of people, both on CHAC and also on PACHA, are sort of doing that work and in the phases of sort of mapping that out. So just wanted to flag that for Jeff. And then Cassandra, your comment is so important, because as part of the workforce, we really have been talking quite a bit about all of these state regulations that limit practice across a number of providers, pharmacists being one, but obviously nurse practitioners, physician assistants, et cetera. And I think the sort of debacle, the dilemma is that we are a federal sort of entity at PACHA, and that much of that work is at the state level in terms of regulations. And so how do we think through what could be potentially an appropriate role for PACHA when it's a state issue? But I think there is definitely sort of interest in thinking about how to leverage all of our healthcare workforce, because we need everybody if we're going to achieve the EHE. So thank you for raising that.
Definitely. And then also there could be like policies and laws that can allow pharmacists to prescribe it under their license versus having to write a collaborative agreement with the doctor and then prescribing it. Like in Florida, we weren't, fortunate to have similar laws to like California where pharmacists can just initiate it with like a quick training. But I think that would be definitely helpful as well.
Thank you for that, Cassandra. And Vincent, for your response. I think Amir was next in queue.
Hi, yes, thank you, Marlene. It's so nice to see you and so many PACHA members. Thanks for giving me a moment just to, I think, touch on a moving proposal here in New York, which I think has very real national implications around HIV testing, especially, I think, connecting with so many things that the full council discussed today, the ambitious goals to end the epidemic, the health needs of older people affected by HIV. And, currently in New York, written consent isn't required to an HIV test anymore. It hasn't been required for many years. But direct oral notice prior to a test is mandated by New York state law. And there's a troubling proposal in New York to replace that direct oral notice prior to a test with any kind of indirect notice. So a boilerplate sign on the wall, a video playing in the waiting room. And I think there's a lot of folks who have concerns for a couple reasons. I mean, people who have visual and auditory disabilities cannot be reached by that kind of indirect notice. Patients who do not read or speak English cannot be reached by that kind of indirect notice. And we at CHLP really feel like opt-out is most meaningful when people do have the opportunity to opt out and just have the fundamental right to decide when, if, and how they're tested. And that, screening people, I think, without their informed consent and kind of respecting their bodily autonomy, I think also undermines really important aspects that we can leverage to end the HIV epidemic, like self-testing at home. So I think, I think many folks might be aware that the CDC is currently weighing in on revising their HIV testing guidelines that are quite, 2006 was a while ago, and we're excited that those guidelines will be updated. But we're a little bit, something that I think we just wanted to raise with PACHA was given, how if New York adopts a certain kind of policy, other states might follow as well. The need to kind of balance obviously, we recognize the need to increase HIV testing, but also protecting the bodily autonomy and really affirming the human dignity, I think, of marginalized patients who really might, should someone be tested without their informed consent, hyper-policed and marginalized and criminalized folks might decide to never connect with care ever again. From a situation like that. So that's just, something I wanted to raise briefly, but and maybe we can stay in touch as the CDC might release their revised guidelines for public comment next year. Thank you.
Mm-hmm. Thank you for that. And I know Duvia and Carol, you had your hand up in queue. So I see Carol is saying she'll pass. Duvia, would you like to make your comment now?
Thank you, Marlene. What a wonderful day. I've learned so much, so many heartwarming stories. I just wanted to mention, as the committees, the subcommittees join and meet next month, that we cannot forget to be inclusive in those policies and procedures of undocumented individuals living in the U.S. with HIV. Regardless of sexual preference, this is an issue that affects undocumented individuals. HIV does not know borders, and I work in the state of Arizona, where we have a very high population of undocumented individuals, and this is a barrier that we face daily. Housing is such a huge issue. A lot of individuals do not qualify for those type of services because of the fact that they're undocumented. So we are having to deal daily with people that are aging with HIV from the trans community, the MSM community, people that are dealing with lack of housing, people that are dealing with, I don't qualify for transportation. So we have to ensure that as we're working on these policies and making these recommendations, we do not forget about our undocumented folks with other status in the country, such as refugees and immigrants, regardless of where they come from. They are coming to our country with a need for HIV services, and they are living in the shadows. A lot of these people are living in fear. I've had hundreds of people. December is a very high month in our clinic that need assistance. And, you know, luckily we work in an organization, we're blessed to work in an organization with a lot of resources where we can serve people that are undocumented from other funding sources that have nothing to do with our HIV, with our national HIV plan. Unfortunately, that's the reality that we're dealing with right now. So please, I urge my fellow PACHA members to not forget about these individuals as we write and recommend policies, that we ensure that these policies are inclusive, so that these individuals, you know, so that we can assist these individuals in decreasing those barriers to care that are so, so important. Thank you.
Thank you, Duvia. And I know because I'm very familiar with the work of what they are doing here in Texas, but I'd certainly want to, because I see you here on the line, invite Evelio to comment or respond in any way. I'm just in awe by a lot of the work that you have been doing throughout our state in particular, and certainly working with undocumented communities. So I just wanted to invite you, if you wanted to share anything live with the PACHA group while we're here this afternoon.
Thank you, Marlene. How are you doing?
Good, good.
Greetings to everyone. We had an amazing year this year at the Latino Commission on AIDS in Texas. We went to go visit 6 sites all over Texas at HIV serving agencies and tested the stigma and the health literacy of clients, and also had focus groups with staff and also with clients. And we found that there's very high levels of stigma and very low levels of health literacy in these communities. And it really needs to be addressed among Hispanics and Latinx communities. It's something that we really think about not really focusing on, because sometimes it's very underfunded. You know, we're so focused on the tests and we're so focused on the appointments, but sometimes they don't really understand. And we talk about language justice in a certain way about translating and being bilingual, but it's really making sure that the client understands the information that they're being delivered to. The service delivery has to be much more effective. And it's something that they really are yearning for, to have a complete understanding of the information that's provided to. One of the most exciting things that I asked people, what's the most exciting thing to do, you know, in their job? And one lady said, you know, I love talking to a newly diagnosed person and really explaining to them the entire system of care. And I take my time with them. And that's so, so important, having that warm handoff. So I appreciate the time. Thank you.
Thank you for that, Evelio, and allowing me to put you on the spot a little bit. I know that we also heard from Oscar this morning from Vienna Star, and he sort of touched on the same sorts of issues around this relationship building and the need to have space in place to be able to do that. Many of these communities who've been under attack and in the throes of violence being directed toward them from a number of different ways really, or not only just stigmatized, and that keeps them away from getting the services that they need, but they are truly afraid and unaware of where they can seek and receive some of these services in a safe way, in a safe space. So I appreciate your response to that, and for Duvia, you lifting that up for our awareness to continue to ensure that we have some intentionality around undocumented populations. Mackenzie, go ahead.
Awesome. Thank you, Marlene. I put my hand down, but my mute stayed on. I just wanted to note real quickly, I wanted to thank the White House. You know, I think we all know that a lot of the EHE funding is at a little bit more risk than it has been over the last few years, and it creates a lot of scary times. And it's been big on my mind, and thinking about this meeting and what all we could do to do everything we can do to make sure that that service funding doesn't get cut within the powers that we have and not overstepping, but making sure that we do everything we can do. Just thinking about it, and actually Carl Schmidt shared that the White House put out a nice statement of administration policy, basically on November 13th, just before funding got extended for a bit on the 17th, saying, hey, we can't take this, basically the president said that he'd veto the spending bill as it was. And sorry if I'm messing up some of this vocabulary to the federal level. But he said, I'd have to veto this bill because all these things are not like up to snuff with it. And one of the paragraphs that he mentioned specifically in a 4-page document was the HIV services. And so I just wanted to say thank you to the White House for prioritizing the people we care about, and upholding that initiative, at least so far, and hopefully until we get the job done. So big shout out to that. And then the thing I was going to say earlier that's a bit more evergreen and like might have been better like contextually when it first came up, but when the guys spoke during the trans male panel, I just wanted to say thank you to them. I think AJ is still on the call. I'm grateful that I don't need to, whenever I get on a call, need to discuss how I feel about my masculinity. And for them to field those questions with such thoughtfulness and grace and inform all of us, frankly. I'm just very grateful to them. And I think that they're kind of jumping on a sword now because they get to answer all of our questions, and hopefully the next generation, all this will be common knowledge and far less stigmatized. And so they're blazing a path, blazing a trail. And I didn't have a question for them. I just wanted to say thank you. And it still holds. So thank you to each of them. And also I'd recommend, shameless plug on all our behalfs. I'd love for each of them and anyone of trans male experience to apply to PACHA. I think it might be like a demo that we don't have represented right now. And we're wonderfully diverse, but that's a group that I want to add, you know, and I think we'd all benefit from adding. So thank you so much to everybody. I think this has been a phenomenal meeting. And that's my triple comment. I'm done for now. Thanks.
And there have been a few of us who have quietly been pushing in the chat and in direct messages about getting one of those panelists to apply actively to become a member. So you're right on target with that thinking, Mackenzie. Carol, I will certainly turn the floor over to you, and just wanted to remind the group we've got just a couple of more minutes. And so if we do have community members here who would like to make sure that you got a comment or a statement made direct to PACHA, you have an opportunity. So after Carol, the floor will be open. So go ahead, Carol.
So being new to PACHA, I'm still not really clear about when to say what. So I'm just going to bring it up here. I think that one of the issues that comes across all the discussions we had today and the many discussions that we did not yet get to is workforce. and whether that's workforce training about HIV and aging, about transmasculine care, about border health, about language justice. Workforce issues are in my opinion, are the big, whatever you want to call it, in the room, right? And so I would like to, again, not knowing the processes here yet, I would like, Hope Act, all of this is intimately connected to workforce. And so I would like to suggest that we really have a focus on workforce issues, whether that's through dare I say, a subcommittee, or a day or a agenda item, because unless we talk about the issues, and it's not just the nursing workforce, it's the pharmacist workforce, it's the physician workforce. If we don't talk about the issues, whether they're longevity or current practice or approaches or reimbursement, all these other issues are important, but I can't imagine them moving anywhere if we don't also address the workforce. So again, not sure if this is the right place to put this, but it's the only place I know. Thank you.
Wherever we make space and say it's okay, Carol, you're right on target. You can share here. We also have opportunity in our next part of the agenda as well. So feel free. Our hope is that when we're live and when we're in person, PACHA-to-the-People is quite interactive. We really do have members of the community who come out and share, and it has always been quite impactful, even for me, just to watch the interaction and engagement, because I do think that really helps community to know and understand and feel that they've been heard. So I certainly like to invite PACHA members to have those exchanges when we have community in front of us. And anyone else before we close out the PACHA-to-the-People session? It's always more challenging online, but our tech support usually does extremely well to make sure that these things run seamless. But our hope and our goal is to make sure that we take what we hear and actually infuse that into the work of the subcommittees. And so I know myself, along with other folks at Team PACHA with the Office of the Secretary, we take these very seriously, and these notes actually do go into our PACHA subcommittee conversations and what we might be able to do and lift up and proceed with some action around. So that is what we'll do from today's conversation. We will take that back, and we will make sure that you all are kept abreast. I think the other thing that I've been proud of in this composition of PACHA is being able to feed back to community at each and every subsequent meeting. What have we done with the comments, and what actions have we taken with the feedback? And so that really does dovetail us into the next part of our agenda today. So with that said, I think we will formally conclude this PACHA-to-the-People section. Vincent, is there anything you want to say before we transition back over to our full meeting room?
I think, Marlene, my comments actually fit nicely with the next part of our agenda.
All right. So with that said, it gives folks just a couple of minutes, if you can, switch back to our regular meeting space, the link that we were on for most of the day, and I will see you there shortly. Thank you.
Produced by the U.S. Department of Health and Human Services.